Yeah, you should do it. You'll love it. It's one of my favorite treatments.
Well, it's something to do.
It's great. I'll tell you exactly how to do it.
Came by, I set up time, and they told me to go to work.
You get a little earlier, and you'll be ready to go. Beautiful.
Oh, that's magma. That's
I know there's a thank you. I know there's a calendar by magma. You gotta.
All right, so who's filming live from our set? Well, Hannah should be over here with Tracy.
Yes, she should.
Should be over here with Tracy. Come around. Come on down. You want to do it? Are you doing Insta or Face? Insta? Okay, here. I'm going to turn on Face. Okay, so... Put it on here.
Is there another stool or?
Okay, so put that on there. Do add SaltFacial. Just want everyone to know. Once I take this down, this off. Okay. Alright everybody, welcome to the SaltFacial Q&A with me, Dr. Emer from Los Angeles, and my esthetician Candace here, and also the lovely people at SaltFacial. Thank you all for following and coming. We really love this device, as you can tell from my live speaker that I did on the main stage not too long ago. So I figured, why don't we do a live treatment? I'll talk through it, and then tomorrow I'll get the treatment. That'll be good, because last year I get like one every month or so we might as well just do it now. It'll be perfect. So myself and Candace can ask questions, but we'll get ready to bring you over in 1 second.
Brenda,
come
I'm
over
ready
now?
when you are, my dear.
Are you ready?
Yeah, ready?
Okay, come on over. Brenda's volunteered graciously. Yeah. For everybody following on social media, Dr. Emer, we're here at the Wynn Hotel at the Aesthetic Show 2018, and we're going to be doing a SaltFacial treatment on one of our beautiful volunteers, Brenda, from California. And what is a SaltFacial? It's a 3-in-1 treatment that's done to not only exfoliate the skin to make it look brighter, but also has the ability to infuse medications using topical creams and medications using ultrasound, and then calm the skin down and boost collagen production with LED therapy. Again, in the past couple years, combination treatments have really come to favor because they give better outcomes. Anybody that's not doing combinations or offering you those combinations are just really not doing, what medical grade treatments are supposed to do. You can go to a spa and get a simple treatment, and that's fine, but we call that pampering. We don't call that medical treatment. This is a medical treatment, which is different than just a simple facial. Candace has been doing an esthetician for 12 years, and before, come over to everybody on social media, before doing medical grade treatments, what were you normally doing?
Mostly fluff. I mean, people come in, they want to relax, do extractions. For like the spa world, microdermabrasion is probably as extreme as it
light
gets.
Exfoliation,
Maybe
some fluff,
peels.
but that's nice. That makes you feel great. That's your, go to the spa, relax. But do we want to treat pigmentation? Do you want to treat fine line prevention? Do you want to treat redness? Then we need to work our way up to a medical grade treatment. So that's where things like this come in. Now, obviously, as a dermatologist, it has a lot of gadgets and toys. We can do a lot more things. But if you're not, you don't have all that, and you have a spa and you want to kind of step up it a little bit, we can, what are we doing? What are you doing over there? You like smile like that. We can use this all-in-one modality to get a really good improvement in the skin texture, skin color. Actually, we have Jeremy in the back right there, who had the first, one of the first SaltFacial treatments ever on social media. His face got almost millions of views. Obviously, great looking. He's been doing SaltFacial for a year. And Jeremy, come over here really quickly. Let's do a Q&A. Jeremy, I'm calling Jeremy out because Jeremy was one of the first people on social media to do SaltFacial. He's been doing it for a year. So
Yeah,
Jeremy,
monthly.
tell people, what does it feel like? What does it do for your skin?
It's great. I mean, right now my skin's so dry. I feel like it gets all
Well,
the dead skin
we're in
off.
Las Vegas, so you get very dry.
Yeah,
but
it cleans out all my pores.
Cleans out the pores.
It's just amazing. It's like a microdermabrasion times 10.
So times 10 microdermabrasion. So again, a step up to a medical grade treatment. You can see they have great skin because they do these treatments. But again, you know, I'm not saying this is the solo treatment. If you have this, it's going to help, but it's going to complement the other things you have. Microneedling, aqua gold, lasers, radiofrequency treatments. You could literally create anything, you could trademark anything you want with the combination, because it's going to give you a great outcome. So you can really diversify your treatment plan with patients. You can be doing IPLs, you can be doing laser genesis, aerolase. There's a lot of stuff you can do to dermally heat the skin and get collagen production, but also extract, exfoliate. The one thing that we like it the most is when do we use this the most?
Free laser.
Free laser.
Every patient has to get a SaltFacial
Have to
before a
get it.
laser, or he will not laser
Or
you.
I'm not going to laser you, because
Yeah, it's
the
just the
results
rules.
are better. They're just better when you exfoliate the skin. Now the initial concept design was a little less strong. Now we've bumped up the energy so that you can do much more than a simple microdermabrasion to get to that medical grade treatment, and then do much stronger lasers. So you are getting like double your laser treatment in one.
Yeah.
You know,
Yeah.
and your skin's clean and it's less likely to get an infection. So yeah,
I think
what else?
the most important thing to note is that with this, there's no suction. So for people who have rosacea or redness, or that just have very sensitive or compromised skin, this is the perfect treatment because we don't compromise, you know, maybe the suction that would create more broken capillaries, things like that. So for me, I feel confident treating every skin type, no matter how sensitive, because it's safe, it's effective, and we get results from it.
Yeah, and that's the thing. If you're really thin skin, you're autoimmune disease, you're on steroids, you've been using topical steroids, you just have very fragile skin. Suction-based devices can compromise it, and it can often leave you with telangiectasias, which are dilated blood vessels, and irritation. We have patients often coming in with scratch marks from simple procedure. I'm not saying we don't have suction-based, we have two, but this is one of those things that can really work well. The other thing too is thick skin areas that are very oily do very well with this. You could treat thicker areas like the elbows, knees, and feet, which is really where I feel are going to be a huge market for this. I think all pedicure places should have it. That's one thing I think. But the other is men's skin, because men's skin is very oily, it's very sebaceous. You can even combine a suction-based device with this exfoliation device. We call it a salt and silk, but you can call it whatever you want. We call it a salt and silk, and we get a really, really good improvement in the overall look of the skin as a solo treatment, but again, before lasers or peels. Those peels are going to get much deeper and get way better of an outcome if we do that. Actually, Justin right here just had that done 3 days ago.
Yeah.
Let's show Justin's skin. So Justin had SaltFacial, IPL, fractional radiofrequency, and deep radiofrequency, just to show his face here. And it got rid of all the pigment. He looks already 12, we already know that. But now he looks 11, I don't know. He looks really young because we got rid of a lot of his redness. His pores are reduced, and look how smooth he looks. It looks really good. But all that in combination in just 3 days, and his skin looks so good. So in the past, IPLs, I mean, you're swollen for like a week. You know, everything, again, when you get rid of the dead cells and you don't have to push energy past the keratin cells and a buildup of dead skin cells and oil, you get a lot better of improvement and less scatter and inflammation. So do you guys have any questions right now? No? Should we move over to the treatment?
How much do you charge usually for treatment?
Well, I mean, it's just, honestly, the charges for this can range from anything. In our office, I think it's somewhere between $300 and $500 depending on what you're doing. We package things in. You know, it could be the lowest at $200 to $250. That's what I would say. But you know, if you're doing the full therapy, that's a 45-minute treatment. I mean, it should be a medical grade, $200, $300, $500, something like that. But you can add on. You know, I really like to use microneedling and topicals at the same time. We do a lot of this plus fractional radiofrequency, like what he got, because it's very little downtime compared to a laser. But if my patients are coming in getting erbium and CO2, I'm being really aggressive on this. Same thing if we do peels. We're pretty aggressive with peels. My fellowship was like, I did phenol. Okay, I had people like asleep when I was doing peels. So it smelled crazy. So it was insane, my fellowship. But we did really aggressive peels, but it would take them weeks and weeks and weeks to heal. And stuff like that. Now when you're doing LED and you're doing this other stuff, you can get really aggressive peeler improvement very quickly with not as much downtime. So yeah, let's come over. Let's bring the cameras over. Let's go over. So we're only on a 4, right? I figured. So if anyone wants to come and see the salt tracks, do you taste the salt yet?
I do not.
I feel like all doctor's offices should be giving margaritas with this. Would you like your salt rim with your SaltFacial?
Exactly.
That's what I think, although I don't know if it's legal. But so the key is to get really good salt tracks and watch the skin. You're really retracting and spreading the skin so you get a nice exfoliation. And she's being very generous and very, very kind at a level 3, so that she can look really good for the show. But if we go to like then she'll be a tomato.
Yes.
But that's okay if she really wanted that.
This is perfect for.
She had a really good question.
So what was the question?
This compared to HydraFacial, where it actually hydrates the skin, why is this better for lasers?
Yeah, well, that's a good question. So with laser, so here the question was, would you do an infusion facial or a vacuum or suction-based device before a laser treatment? And technically you shouldn't, because you do not want to be overly hydrated, because the light and energy is scattered in the water except for a CO2. If you're doing a CO2 laser, the chromophore is water, and you will get a little bit more absorption of heat, but that doesn't mean it's attracted to the skin. That means it's attracted to the surrounding fluid, which causes more downtime. And actually it's not a good idea. So it'd be better to do something that exfoliates, dermaplaning, extractions, this over doing that. So what we typically would do is we'll do this before the laser, and then a couple days later we have them come back at oxygen, exfoliation, vinegar soaps, etc. Then they're doing the other stuff at that time. But you wouldn't want to do infusion now for a pre-aggressive laser, you know? We like to actually do the ultrasound with topical numbing.
Yeah.
That's the trick.
Yeah.
Patients love it.
Infusion of topical lidocaine. So use the cavitation with your topical, and then the patients don't feel anything.
So Dr. Emer,
Yes?
Brenda just asked how long do you like to wait, or what do you recommend as far as after fillers? What would you wait?
After doing the filler, so
What would you do?
So here's what I would
Before
do.
filler.
We do this before you do filler. So she said, how long do you need to wait between pre or post filler? I'd have people come in, they get this done, their skin looks good, it's clean, they get their filler, then they do the light therapy. It's easy.
And
Same day.
It won't cause.
And you can get an IV, you can get a back massage, you can get foot treatment,
At our
whatever you want.
practice.
We'll order you food from Roku, right? And then you said you could spend the whole day if you want. That's when you really should give the margarita after the filler. But yeah, you could do it all on the same day. Any questions from social? No?
Talk
Nothing?
about the salt.
Yeah.
Why don't you talk about the salt? So well, the question is, where are we going to go with the salt and this technology? I think there's a lot of places. Treating the body, treating off the face like we talked about.
Well, right now we're treating ingrown hairs.
Oh, yeah?
And that's been amazing. I have a patient that's been coming in. She has folliculitis and ingrown hairs, and we've been able to treat her. I think it's her second treatment, and
It's all gone.
it's amazing how much we've gotten.
Inflammation in hair follicles. You know, women, Middle Eastern patients typically have a lot of ingrown hairs because the thicker hair follicle, African Americans, that type of thing. So you can really treat hair follicles, pseudofolliculitis, which is in the beard area, etc. But you could treat the chest, the neck, you can treat off the face. I think eventually we're going to go to different types of salts that have different ingredients infused into them that will also go into the skin, etc. Can't give it all away. And then we talked about earlier our Accutane patients. This is great for Accutane patients. You exfoliate everything, you use the salt to infuse topicals, They are so dry, it's insane. This actually hydrates them significantly
It kills the bacteria.
and kills any bacteria, which there are lots of studies showing increased staph infections in patients on Accutane. So, any questions from the audience? No?
What types of creams do you
Infuse it with the ultrasound.
I have not had a cream that I don't do.
Okay.
A lot of vitamin C, a lot of hydroquinone, kojic acid, vitamin B, hyaluronic acid, growth factors, stem cells,
They're Mandelic.
PRP, mandelic acid. We could do a combination of very light things like lactic, mandelic, salicylic.
It just pushes it further into the skin. It opens up the space for everything to be infused. Yeah, whatever that patient needs, you test.
Yeah, if that patient has hyperpigmentation, you do glycolic and stuff. I personally am more of doing salicylic for pigmentation actually. So it's a very cooling. Salicylic is the only anti-inflammatory chemical on the skin. Not too bad. No, not too bad at all. And what patients am I more aggressive with? My staff knows I'm like the most aggressive
Whatever gets the
dermatologist.
results.
Mine is, do we want results? So I tell patients come to see me, I tell them, where you start? Can I have a month of downtime? Because if it is, I'm going to do J-plasma. Do you have 2 weeks? We're doing CO2. Do you have a week? I'm going to do erbium combination. Do you have less than that? Now we're going to play. There's a bunch of things we could do. We could do this plus a lighter laser, this and microneedling. Just depends. Do you want to glow? Or do you want to, refresh? What are we trying to do? Repair or enhance? I don't know. It depends on where we are. With a lot of lasers, so for example, someone like you, light skin tone, light eyes, you can really do whatever you want. My opinion would be every 3 to 4 months, you should be doing either an erbium or a Fraxel with IPL in combination with this. Every single month, you should be doing this and something light, like either just microneedling aggressive or radiofrequency treatment like a Venus Viva, Skin Infinity, and microneedling radiofrequency. You should be doing that every month. And then every 2 weeks, you should be doing some sort of infusion facial.
So my question
Boom.
to you is, I had CO2 done
Yeah, that's fine.
a year ago.
Yeah, every year,
So now,
once a year.
Now I want something that will kind of that.
Right, that's great. So, but you're past that time. So here's the thing. So she had CO2 a year ago and said, what can I do to maintain it? I'm like, we're past that time. 6 months went by. Let's re-CO2 you, or if you were nervous about that, you didn't want to, then we go into the Fraxel combos. Every 3 months you do, 3 or 4 months you do a fractional non-ablative, a little bit stronger. Every month, light, microneedling radiofrequency, or Venus Viva, fractional RF every month. But we would re-CO2 you or erbium, and then 6 weeks later, get back on the plan.
I can't believe you get a treatment plan.
I got you now. You know how much that costs in my office?
I know, really? Wow.
That
Oh my
question
God.
right there would kill me.
Yeah.
Anytime someone's like, I don't know what to do, he will kill me.
I would go crazy
You have
if someone
you have
said,
a treatment plan for life.
Jeremy, you're in trouble. You need a treatment plan for life. And your treatment plan, the reason I would add in a vascular laser, laser genesis, XLV, Aerolase, and IPL would be because your skin tone has the tendency to want to develop red. You see all this? Tracy too, same thing, this type of red. That's sun damage. That is your precancerous cells. We need to lift them to the surface and bring them out. And by doing that, vascular will get brown and red, the non-ablative will exfoliate. So CO2 would be good again, or an erbium, you go a little less, and then start Fraxels as your long term. With this, every month. That'd be perfect.
Or weekly if you're me.
Yeah, or Jeremy if you're weekly. Every week he comes in with some sort of peel, some sort of microneedle. Something's done every week. This one masks every 3 weeks, every 3 days. Does some sort of mask. And then Ian over there, I make him do stuff without him wanting to do it.
I know.
I'm like, get over here, you're doing a peel today. He's like, not the strong one.
So what is on top of my face? Right now
So-
we have mandelic acid and a gliding gel, which is it's a gliding gel with plant stem
So
cells.
yeah, so again, right now, rather than just a hyaluronic acid, this is mandelic acid. We're gonna give her a little bit of exfoliation, calm it a little bit and push it deeper into the skin. You see she's a little red, so we've exfoliated some microns, a little bit at the surface. And then now we're gonna go a little bit deeper with a chemical to push that in. Could we do an actual chemical peel right now? We could. She would get a great result from it, actually. Like our black label peel would be great for her, but she would have 10 days of peeling for sure.
You use your SaltFacial facial prior to Cosmolot, don't you?
Yeah, all the time.
Lifts up all the debris, and then we don't have to work through that dead skin. Yeah.
Yeah. So this is the ultrasound. How does the ultrasound feel?
Relaxing.
So if you were in a spa setting, would you fall asleep?
Absolutely.
Great.
Without all these
Without
people
a doubt.
standing around you.
I fell asleep last year.
Yes.
I love this around my eyes. I feel like it tightens my eyes so much.
Yeah. So eye tightening, fine wrinkles.
If you have like
know,
an event that night, oh, it's amazing.
This is where if you have a practice, you should just package this. Make it a package, you know. Create the year-long treatment plan for somebody.
I'm just telling everybody to do this when we get back to the room so I can actually look like a human again.
That's great. So this is a medical grade ultrasound similar to what chiropractors would do to stimulate anti-inflammation and healing. But again, we're just pushing these into the active cells now because the dead cells are gone. They're off. And the salt on the surface is just absorbing, it's bringing it in, you know. Now I wouldn't go the other thing I want to say too is someone today was asking me like, what chemical do you put on right after when you do the microneedling and stuff? I'm like, look, before you do all this stuff, you really like practice this a little bit because I had a patient who went to one of my lectures and then she decided to microneedle a very strong retinol peel on her scar of her tummy tuck, which completely got burned. She got hyperpigmented and scarred from it. You have to understand what to do before just doing it. Don't go do a TCA peel right after doing this without some experience. You know, take a little bit of time to figure that out. And then, you know, the other thing too is I have patients that don't want a lot of downtime sometimes, but they really want stronger treatment. So for example, your eye and mouth area, maybe I'd CO2. If you don't want to do your whole face, then Fraxel the rest. You know, then you have a little less downtime. So now that's been done. Do you feel any tingling or anything? Just feel great. Perfect. Then the last step is going to be
High-powered LED.
to give her light therapy and boost some collagen and make her look beautiful for tonight, whatever she's doing tonight in Vegas. I'm sure she's got a date.
She may not tell us.
She might not even say, but that's okay. Anything's allowed in Vegas. Her husband or other husband. No, I'm
That's
kidding.
right. Her husband or her boyfriend, whichever one. Right. Whichever one shows up first.
So what are you going to choose? So tell us about the different LEDs that you have. Tell us about the lights. Because this I really wanted our Instagram, people ask all the time, tell us about the light. Why is this light so good and powerful? What's different about this versus other lights?
So this LED is a very powerful light using military and medical grade. I'm going to turn it this way. So that,
Military.
yes,
Wow.
military. Stealth technology.
Stealth technology.
That's right. It just means that we can actually use a non-scattering form of light.
That's really
so
good.
they're very, yeah,
So it's very focused.
Very
so this
focused,
is
very direct.
non-scattering light. How many
And
LEDs are in there?
1,756 lights.
1,007. You should have made that a game.
There
Oh
you
my
go.
God.
I know.
You can't give that up. I'm not saying anything. We should have made that a game. If you can guess
So
the
we
number
have
of LEDs.
4 different lights on here. I'm going to count to 3. It's going to be really bright.
Show here. She's going to show the lights. Show the different lights.
So we have 4 different modes. Acne light therapy, which kills the bacteria that causes acne. Blue light for activating levulon or just for acne. Collagen, which is a deep penetrating wavelength, plus blue light or red light for stimulating cellular change. And we're going to use on Brenda the skin rejuvenation, which is red and amber, and that is your workhorse for reducing redness and swelling after
Which is
treatments.
good for her because
absolutely.
she also has underlying redness in her skin
Yes.
anyways.
It'll take care of
And
that.
we want to get rid of
blushing.
that flushing and blushing that she has. Let's calm that down.
Yep. So, I'm gonna,
So we're going to do that skin rejuvenation. Let's hit it.
1, 2, 3, bright
it.
light. There you go.
Gorgeous. So now you meditate.
That's right.
How long does this go for?
This goes for 20 minutes.
20 minutes. You want a really good treatment today. Wow.
I'm going to put that right there so that we don't blind our
How did you sign up?
viewing audience.
Seema is here and wants the treatment.
Yes, she does.
So that's SaltFacial QA. Does anyone have any other questions or no? Anything on social?
No.
All right, you guys. So you got to see all 3 steps of SaltFacial. You got to meet Tracy, our SaltFacial master trainer and gorgeous model, mother and friend.
Thank you.
And then Candace, say goodbye, Candace, our master esthetician. And Jeremy, who's had treatments for a year. Thanks, guys.
Thanks.
Yeah, he's a SaltFacial icon.
He is.
You can have a face like this.
I know.